Hi, my name is Chase, and welcome to the Wellness Center podcast, where we're going to talk all things red light therapy. Thank you so much for tuning into this episode. Please make sure to like and subscribe so you can get updated and notified on all of our newest episodes that we'll be releasing. Have a great rest of your day and enjoy the episode. Hey everyone, this is Chase, and welcome back to the Wellness Center podcast. Thank you so much for tuning in. I really appreciate it. We are going to be talking about something really exciting today. It's what we consider here at the Wellness Center to be our bread and butter, and I just can't wait to talk about it, get to educate people a little bit about it. And so we're going to get right into it today. So just so everyone knows, this is my camera, this is my computer screen. So if I'm looking over here, I'm just looking at all of the studies. We're going to go over concussions today, post-concussion syndrome specifically. So we're going to go over what post-concussion syndrome is. We're going to go over a scientific peer-reviewed published study that's going to talk about the efficacy of red light therapy and treating post-concussion syndrome, as well as some at-home remedies. So we're going to get right into it today. All right, so post-concussion syndrome. So I am here on Mayo Clinic. I love Mayo Clinic. They're awesome. So Mayo Clinic says persistent post-concussive symptoms, also called post-concussion syndrome, occurs when symptoms of a mild traumatic brain injury last longer than expected after an injury. So typically, in speaking with a lot of doctors, they've told me that the average time for a brain to heal after a mild traumatic brain injury is 2 weeks. So I'm not diagnosing you, I'm not a doctor, I can't do that. But in the event you get a concussion and some of these symptoms that I'm about to read off are lasting longer than 2 weeks, I would advise going back to your doctor and seeing if you guys might have post-concussion syndrome. And if you do, come here. So the symptoms may include headaches, dizziness, and problems with concentration and memory. So that is all true. So what I've noticed as well is post-concussion syndrome can also appear to be anxiety, depression, brain fog, lack of energy, poor mood regulation, a poor ability to stay calm and peaceful, nauseousness, and a lot of other things. So it can be a lot. There's a lot of things that can lead to what post-concussion syndrome is. Now, right here, we are on this is from the Fortune Journals. This was published back in 2022. And the title of this, now we're reading the scientific study about the red light therapy, says the impact assessment of photobiomodulation therapy for post-concussion syndrome. The impact is a test to see how concussed you are. Now let's read the abstract here. So it says several studies have detailed the efficacy of photobiomodulation therapy. A lot of studies have said this is efficient as a treatment for concussions. As there are no widely accepted imaging or laboratory modalities that document concussive injuries, monitoring improvement objectively proves difficult. Hard to study concussion. IMPACT is a computer-based neurocognitive assessment tool meant to measure cognitive performance and subjective symptoms for concussion injuries. This study uses IMPACT as a means to document an improvement in symptomology for patients with persistent post-concussion symptoms pre and post-treatment with photobiomodulation therapy. So here's what they said. More or less, they have the IMPACT test that measures how your brain is, and they had some people do the test right after their concussion and right after treatment for their concussion with photobiomodulation therapy, red light therapy. So here are the methods. So this retrospective study reviews patients' performance in the IMPACT test in a cohort, 35 patients, in a group of 35 patients who are diagnosed with mild traumatic brain injuries and experiencing persistent post-concussive symptoms. Patients initially took the post-injury 1 test and then underwent photobiomodulation therapy using the BioFlex Duo Plus system 3 times a week for 4 weeks using approved parameters for treatment of the cervical spine soft tissue injuries. So again, 3 times a week for 4 weeks. That is like the minimum for a course, is what we say here. After the 4-week treatment, patients took the post-injury 2 test and the results were compared. Results: all patients improved clinically after photobiomodulation therapy and their injury to impact test results were significantly better compared to their post-run injury impact test results. So the conclusion is photobiomodulation therapy may provide neurological rehabilitation in patients with persistent post-concussive symptoms. And impact is an appropriate and objective measure to monitor and assess improvement. So, red light therapy. All right, some at-home remedies. We are at flintrehab.com, and we are going to be reading through a couple different remedies to help with post-concussive symptoms. First is acupuncture, fish oils, flavonoids, saffron, turmeric, essential oils, creatine. That's cool and interesting. Light aerobic exercises to get your blood pumping, and of course, cognitive rest, allowing your brain to heal. All right, everyone, that's what I have for you. We can definitely help with post-concussive symptoms and post-concussion syndrome. We've had hundreds of people come to our wellness center, I can't say clinic, wellness center for post-concussion symptoms and struggling with post-concussion syndrome. And they've seen, if not immediate, within 2 to 3 weeks, relief. So if you're suffering from post-concussion symptoms or know someone who is, send them our way. We can help them out. Everyone, thank you so much for tuning in today. If you haven't already, please make sure to like and subscribe. Have a great rest of your day, and I'll see you guys on the flip side. Peace out.